Welcome to the ASRS Oral History of Retina series. The purpose of these interviews is to capture first-hand stories from individuals with unique retinal insights of historical significance.
Through these discussions, we will fill in gaps in our understanding of the evolution of the science and practice of retina. And it's our hope that these discussions will serve as the illuminating element in the larger mosaic of the history of retina.
Today it is my pleasure to speak with Dr. Carol Shields. Dr. Shields is the Chief of Ocular Oncology at the Wills Eye Hospital and Professor of Ophthalmology at the Sidney Kimmel Medical College of the Thomas Jefferson University. She did her undergraduate studies at the University of Notre Dame, where she captained the women's basketball team for 3 years and was named to the Academic All-American Hall of Fame. She attended the University of Pittsburgh School of Medicine and did her residency at the Thomas Jefferson University within the Wills Eye Hospital. Carol is well known as half of the dynamic power duo that includes her husband, Dr. Jerry Shields. The couple met during Carol's residency at Wills, and they went on to build their career at Wills, working side by side. They are true pioneers who have had a profound impact on the field of ocular oncology as both clinicians and educators, impacting the lives of countless patients and families faced with the diagnosis of serious blinding conditions like retinoblastoma and ocular melanoma. Carol is a prolific publisher and an amazing teacher and lecturer. She has received innumerable awards, including the ASRS Founders Award, the AAO's Life Achievement Award, and the Donders Award. She has served as the president of the International Society of Ocular Oncology and of the Macula Society. It is my true pleasure to welcome the remarkable Carol Shields. Thank you for joining us here. It's going to be a pleasure to spend some time talking with you. We thought we'd start a little bit with what brought you into medicine, looking back with your family and the history that you have.
Sure. Thanks, Tim. Thanks for inviting me. I come from a family of 8 children, and I think my biggest influence, other than my other siblings, was my father, who was a family medical doctor, interest in cardiology, and he would often take one of his children with him when he did house calls. And I recall visiting some local patients of his, sitting on the couch while he took their blood pressure and listened to their heart. And I said, yeah, I think I can do this. I think I can be a medical doctor. And as I went through high school and college, I thought more about it, but I thought of alternative careers, like maybe I should go and become a pharmacist or become a basic researcher. But when I entered college, I really loved the biology of human disease. And so I set my focus on being a doctor. So those were my early inspirations. And it doesn't hurt having a mother who's a registered nurse and a father who's a physician. I grew up with healthcare, so I really didn't think that much outside the healthcare box.
I think that's interesting because some people with healthcare family experience look far away from healthcare initially and then come back. You've always been uniquely team-focused. Do you think that comes a little bit from a family of 8?
Yeah, you bet it does. I just want to let you know a little story. So when I was at Notre Dame, I was all about studying. I was all about becoming a doctor, or if I could, becoming a scientist. And I lived in a little dorm called Farley Hall. And on that dorm was a torn-out sheet of paper that said, women's basketball tryouts. And having grown up in a family with 5 brothers, I knew how to play basketball. And I knew how to play street basketball. And ain't nobody gonna stop my shot. And my jump shot was faster than anybody's. So I was ready. I had the know-how to play sports. So when at Notre Dame, I tried out for the team, I made the team. And it was the beginning of history. because I was on the first varsity team at the University of Notre Dame. And we created a team that was a beginner's team, but it soon became a national championship team after several years. So I feel very proud of that, being on the first varsity team. But it was more than playing sports. It was about working with people. You know, we had people of all different skills, and some were good on defense, some good on offense, some could shoot, some couldn't shoot, some were best on the bench telling you what to do. I mean, we were kind of a haphazard group of gals playing basketball. But I learned the importance of working as a team and listening to others and reasoning what is best and learning from the mistakes or the successes of others. And it also taught me how to handle wins and losses. You know, it's always fun to win a game, but there is a good way to accept the win and a bad way. And there's a lot to learn from losing a game and how you graciously, you know, congratulate the other team, and you learn from, you know, the errors of the game. So it taught me far more than just playing sports. And I carried that into my medical school and my years at Wills Eye Hospital.
You have a special recognition from Notre Dame from your days as an athlete. So could you tell us a little bit about that?
Yeah, so I was one of the pioneers. It was before women's sports were really recognized. They did not have academic All-Americans back then, but I did get pretty good grades as an athlete. I mean, you would have loved seeing me in the van. We didn't go by bus, we went by van. But all the pre-meds sat in the back of the van so we wouldn't bother, you know, the other majors. And we all had little flashlights studying in the back of the van till we felt we were getting nauseated. And that's how we made it through. But it was rewarding, and, you know, most of us did well. But many years after I graduated, Notre Dame called me and said, we realized they didn't have, you know, academic All-Americans back when you were a student at Notre Dame, but we have nominated you to enter the Academic All-American Hall of Fame because of your GPA, what you have done with your career, and what you did at Notre Dame. And we don't want that to be overlooked. And we want others to see that it's possible. So I think it was 2006, I had to go down to Florida, and with some really big names, Jackie Joyner-Kersee, the long jumper, really big names, I was entered into the Academic All-American Hall of Fame, and it was a highlight of my career. I mean, when you ask me what are my 10 most proud, you know, awards, that's definitely up there.
To me, one of the things you're really so good at is sort of melding a team together. You're not just the team player. Often you're the leader, and I see you that way through college and medical school and internship and residency and fellowship. So take us from your sports career and an amazing science career into medicine.
Sure. So when I graduated from Notre Dame, I entered the University of Pittsburgh in medical school. And it's interesting, this medical school trained my father and trained my brother Frank, my brother Mike, my brother Pat, me, and my sister Maggie. So 5 of us attended University of Pittsburgh Medical School, and I thought that was pretty cool that we all went to the same medical school as my father. I realized that I really loved ophthalmology and I really loved dermatology. So as you do in a big family, you don't make your own decisions. You call your older siblings and you say, what should I do? You know, I'm trying to make this decision. So I called my older brother, Pat, and I said, you know, I want to make this decision. Do I apply to dermatology or ophthalmology? He said, Carol, that's a no-brainer. Go into ophthalmology. It's a field of good technology, great advancements. You improve a patient's life overnight. He said, it's far better than dermatology, and that was history. So I entered the field of ophthalmology. I arrived at Wills Eye Hospital. Well, first, when I interviewed at Wills, I really didn't think I was going to get in. So when I went for my interview at Wills, most of the interviewees were wearing like dark suits, very quiet suits. I come with a Kelly green suit so they would remember that I was the girl from Notre Dame and that I was different. And I think I made a good impression on them. And I think they could see that I had a lot of energy and a lot of fire in my belly, and I wanted to make a difference in the field of ophthalmology. So I was invited to join as a resident.
When you're at Wills, which was a remarkable place then as it is now, who do you remember interacting with early that made an impression on you?
I mean, at Wills, there were a lot of giants in the field of ophthalmology, beginning with Bill Tasman, Bill Benson, Gary Brown. I mean, they influenced me. George Spaeth in glaucoma, Peter Laibson. I felt like I was being taught by, legends in ophthalmology, and I enjoyed learning from them. My co-residents were also very important, and Rich Huang was a senior resident, and he came up to me and he said, "Hey, Lally," he said, "Carol, I know you're an athlete. You played basketball, and you want to play some tennis." I said, "Sure, I'll play tennis." I said, "I'm not really a tennis player, but I'll play tennis. I can figure it out." He says, "Okay, you come and play tennis, and your partner will be Jerry Shields." And I said, "You mean Shields, the guy on staff?" And I mean, I'm like a first-year resident. And he said, "Yeah, Jerry will be your tennis partner." So we went to the tennis court. It was an indoor tennis court. And Jerry was very groomed. Every shot was perfect. And I was kind of just hitting like to save my life. I played okay. And that was the beginning of a very special relationship. And it was probably the most important day of my life, was meeting Jerry Shields. He was unattached at the time. He was a bachelor, dating around, and I had no interest in him. Soon thereafter, we were seeing each other, and we were a couple. And it wasn't all that easy. Dick Green from Hopkins told Jerry, "Stop it, that is not kosher. You're not supposed to be doing this kind of stuff with a resident." But, Jerry was kind of a younger, junior staff doctor, and it worked out, and history was made. And soon enough, I finished my residency. We were married during the residency. I became an oncology fellow. I moved on to I did pathology at Wills. I moved on to Moorfields and did oculoplastics, and then came back to Wills and started working with Jerry.
So what's it like? I mean, Jerry's remarkable, and he and you both have defined our field in ocular oncology. But how do you find your place there when you come back?
I never wanted to be Jerry, and I couldn't be Jerry. I'm not that backslapping, shaking hand, "How you doing today" type of person. I was maybe a little more scientific, organized, and I saw a treasure in his office files of patients with eye cancers that really needed to be organized and really needed to be retrospectively evaluated. So the first thing I did from day one, we bought a computer. We had one computer in our office. It was a big Mac computer. It sat in the back, and we had to take time slots on when you could use this computer. So I would sign off for Fridays, and I started coding our charts. At that time, we had 20,000 charts, and I would take all the A's and code them, tissue diagnosis, so we could find all the retinoblastomas, all the choroidal osteomas, all the retinal and RPE combined hamartomas. So we had a big database, and I went through all 20,000 charts and coded them. Thereafter, I gave the job to somebody else because it was overwhelming. And that's how we started doing our large retrospective analyses. And we basically went through every tumor. In the back of the eye, we gathered the data, put together very detailed flow sheets, and worked as a team. And we always found 2 or 3 people who wanted to work with us. There were always residents, fellows, retina fellows who wanted to work with us, and they always jumped aboard. And in the usual way of Jerry's way, he always welcomed everyone. You want to do research? Come on, we have a big project going on. You can jump in and collect data on these patients. And that's how it went. So nowadays, I have a real soft spot in my heart for our medical students, our residents, and our fellows, giving them opportunity. And I enjoy helping them in their research. So our fellows, when they come to work with us, they not only learn, how to diagnose retinoblastoma or, look at ICG of choroidal hemangioma or figure out this OCT as a choroidal metastasis, but they learn how to talk to patients, how to handle bad news, how to tell a mother that her child will be blind for life, how to do research, how to do good research, how to collect data and be organized. So we go from A to Z with our fellows and students, teaching them all the ins and outs of ocular oncology and how to be good doctors.
And that practice has really been your and Jerry's laboratory that's led to probably the most prolific writing, speaking career for both of you in all of Retina.
Jerry's philosophy was always to say yes. If you're asked to give a talk, say yes. You'll figure out how you're going to make the talk later. If you're asked to write a paper, say yes. You'll find someone who will want to work with you. And so it was a big job. And when I look back on my career, I can almost sometimes not understand how we got it all done, especially with family. And we haven't really talked much about family, but balancing career with family was a big job. Jerry was a taskmaster. He was, he would divvy up responsibilities and expect, if he said, I would like to have this done in 2 days, you have to have it done in a day and a half. And I sort of learned from him that he wanted jobs done by a deadline. I find myself being the same. When I have fellows in the office and we're behind in the clinic, I'll walk in the hallway and I'll say, hey guys, let's see a performance. Let's move it. And they know that I mean business. And they get in there and they see their patients and we move it to get the clinic moving.
Well, you've both been remarkable solely based on your clinical and professional career, but you did begin to allude to something that to me is incredibly remarkable, is that you've had a remarkable family, and you've managed to do all of this. And that's, having a small family myself, I realize that that's not a simple task. So take me through how that happened and where are the children along the way? And
yeah. So if someone told me, okay, you have 40 years to work at Wills Eye Hospital, see 80,000 patients and operate on them, write a bunch of papers and have 7 kids, I would say, are you crazy? I mean, that's not possible.
I'd say that too.
We just took it one day at a time. I never really thought too far ahead because it was a little bit overwhelming. If I thought, how am I going to handle that meeting in 2 months when my babysitter is not happy today? So, so you just have to balance both fronts. You have to keep your office staff happy and satisfied, and the same at home. And I would have to say that keeping your home staff happy and satisfied is maybe a little more important because those are your children. So one by one, we had kids. I think Jerry thought he would never have a family. I mean, he was a little bit older when we got married. And personally, I always thought about having a family, but I wasn't really sure it would be possible. And we stopped after 4 kids, and then stopped again after 5 kids, then stopped again after 6 kids.
That's not called stopping.
And then we finally stopped after 7 kids. And when I left the hospital after our 7th kid was born, the head nurse on the floor said, "See you, Dr. Shields. See you back in 2 years." And I shook my head and I said, "I don't think so." Yeah, so that's when we finally stopped.
What I've loved too is that you're always giving back. So you don't just take care of your patients. Your patients are a way for you to educate the rest of the oncology and retina and ophthalmology field. So how important do you think that has been for you?
Yeah, very, very important. And I have to go back to Jerry. I learned it from Jerry. Jerry was very free with teaching people, educating people, giving slides away. Here, come write this with me. It'll be good for your career. He was very good at sharing his education, and I always felt that was really a good style. So, we have a very robust fellowship where we train, maybe 6 people a year from around the world in ocular oncology. It's our duty. I will only be here for so long, and then I'm just a memory. And I want the next generation to not start where I started. I want them to start ahead of where I started so that they can take it to the next level.
You've also had that remarkable experience of being a woman at a time when that was relatively rare, and you've been a woman that's led. So take me through that journey for you, and what do you look at for younger physicians coming in, but younger women in ophthalmology?
I remember being at the ASRS years ago when I could count on maybe 2 hands the number of women at the meeting. Julia Haller, Emily Chu, just a few of us. Johanna Seddon, me. There were a few of us, and we sort of bonded at those meetings. I see the future of women in retina as very bright. There's so much support out there, and I don't see people separating us by gender or sex anymore. And I don't see us being separated either by race. I think it's a very inclusive society, and I think the future is going to be just wonderful. The more diverse we are, the more inclusive we are. And of all the groups, all the retina groups that I belong to, I think ASRS is definitely the most inclusive and the most robust when it comes to so much going on, posters and videos and presentations and case presentations and lunch discussions. I mean, it's just everywhere you look, there's just so much going on.
You've been involved with and defined many of the changes in the way we care for what I think are this unique population of patients that have retinal disease that's life-threatening. So can you take me through a little bit of the retinoblastoma story? When you started, where you think those transitions were and where we are now?
Yes, so when I entered the field of ophthalmology, 1983, retinoblastoma was a terrible disease, and it was managed with either eye removal or radiotherapy, and if you were able to save the eye with radiotherapy, most children were blind, and they had dysmorphic faces, and they were labeled for life as being atypical, unusual, and their kids were at risk for having retinoblastoma. It was a rough disease. And actually, we had a few staff people on service, and no one was all too interested in retinoblastoma because it was such a difficult disease to manage. So I volunteered to take over the retinoblastoma service. And in the early 1990s, in marches chemotherapy, 1994 to be exact. And we saw what was going on in England. And then I heard Lynn Murphy talk about it in Los Angeles. And I said we should start systemic chemotherapy for retinoblastoma in Philadelphia. I contacted our pediatric oncologist. We got the program started, and she says, you ophthalmologists aren't going to tell me how many cycles of chemo to give. She says, I'll tell you how many cycles of chemo. So she's the one who wrote the current protocol that's used around the world. Her name is Anna Meadows. She's now retired, but she wrote the six-cycle chemotherapy regimen that's used around the world. I know you like 9 cycles, and everyone has their little different iteration. Every retinoblastoma day was like exciting for me, like, What are we going to see today? Is it going to work or is it not going to work? And am I going to have a lot of trouble? And one by one, we would see these children under anesthesia, and they look great. And we started to believe in chemotherapy, even though I would get up at meetings and I would talk about systemic chemotherapy for retinoblastoma. And I had one person get up in the audience and tell me, do you realize that you're killing kids? And I thought, killing kids? I said, we're saving their lives. These kids not only have their lives saved, their eyes are being saved. And now we know 50% of them have 20/40 vision or better. And we just published more recently in the British Journal of Ophthalmology that this systemic chemotherapy is lasting till 20 years. So we anticipate it's going to last forever. So that was systemic chemotherapy. Then a few years later, in 2008, in marches intra-arterial chemotherapy, a very controversial topic. Started in Japan, popularized by Abramson in New York. We started immediately after he started, and we saw some amazing saves, some failures, and the way we do intra-arterial chemotherapy is we enter the femoral artery. We have a neurosurgeon. Not everyone uses a neurosurgeon to do this catheterization. Some use an interventional neuroradiologist. But we enter the femoral artery, go up the aorta, into the carotid, internal carotid, into the ophthalmic artery, and squirt a little dose of chemo. And on average, kids will get 3 cycles of this. And it has taken kids with very advanced group C, D, and E eyes and totally quelled, totally controlled the cancer and saved the eye. And nowadays, maybe 75% of the eyes that we treat with intra-arterial chemotherapy are saved. So our rate of enucleation nowadays is only 5% of kids. Having said that, just yesterday I enucleated an eye of a child that had massive retinoblastoma. So you really have to know when to enucleate, when to use intra-arterial chemotherapy, when to use intravenous chemotherapy. It's a real art of knowing what is going to work and what is not going to work, and that's where a fellowship comes in handy, a busy fellowship, so you can learn how to put a patient in one of these 3 categories that's going to give them the best chance of saving their life and saving the eye.
I think you also used your clinical experience in a way that allowed it to broaden around the world. So people have learned how to give systemic chemotherapy or intra-arterial chemotherapy or even intravenous chemotherapy in a large part because of the work that you guys have done.
Yes, so we would publish our results. We would publish our 1-year results, our 2-year results, our 5-year results. We just wanted to be sure we weren't missing things that were happening by not looking at our retrospective data. And we published and republished on intravenous, intra-arterial, intravitreal chemotherapy, looking at these results. So I've watched retinoblastoma go from being a tragic, deforming, blinding disease to a curable, non-blinding condition that we can actually now engineer the mutation out of the family tree so the next generation of that child who's affected with retinoblastoma won't have retinoblastoma. I mean, it's incredible.
It's so obvious when we speak how passionate you are through
am.
all of this.
When am I going to lose this
Right.
passion?
So how do you maintain that focus and that drive and that passion to continue, at the level that you work, which is remarkable?
Yeah, I love my work. I actually really enjoy going to work. And I have 2 all-star associates, Jerry, who is now semi-retired, and Sarah Lally. And Sarah and I, we're actually related. She's my cousin's daughter, and she is awesome to work with. And we can read each other's mind, and we have fun at work. And when I see her first thing in the morning, she's always happy. She always says, "Hey, how was your weekend? What'd you do with the kids? Here's what I did." And we talk the weekend. Then we get down to work, and we love our fellows, and I just enjoy what I do. It is challenging, and I know we're good at it. And I still have the passion, I still have the drive. That fire is still burning in my belly. And I hope to pass on the spark to each and every one of our fellows so they can have the same drive when they go back to their respective departments.
You touch families and children and your patients on a daily basis, and it's remarkable.
Thank you.